Hello everyone, I'm Hala Al-Tamimi, a dental student at Al-Farabi Kazakh National University, and I'll teach you about the types of injections. Now, what are injections? Now, what is an injection? An injection is the act of administering a liquid, especially a drug, into a person's body using a needle, a syringe. And an injection can be considered as a form of parenteral drug administration, and it does not involve the absorption in the digestive tract, and there are 4 types for it. The different types are intramuscular, intradermal, intravenous, and subcutaneous injections. Before treating any patient and injecting, we need to do hand hygiene. Now, we all know what a hand hygiene can be, and it has a process. So we need to filter, we need to wash our hands with the soap and rub it correctly for about 5 minutes maximum, and make sure there are no microbes left in our skin. Now, after the hand hygiene, we should put on our gloves and put a spray onto our hands and rub our gloves correctly so we can make sure that all the microbes are removed from our gloves. Then we should start checking the expiry date of the syringe we're gonna use. And after that, we need to get a spray and apply it on the opening of the medicine, and get a cotton to dab it onto the opening of the medicine to make sure that also there the microbes are removed. Then we get the syringe and insert it into the opening or the cap of the medicine, and we get the amount of medicine we need according to the type of injection we're using or applying. So the first type I'll be talking about is the intramuscular injection, and it's an injection given deep into the muscle where the medication is then absorbed quickly by the surrounding vessels. The sites for injecting intramuscular injections would be deltoid muscle of the arm, vetus lateralis muscle of the thigh, ventrogluteal muscles of the hip, and dorsogluteal muscles of the buttocks. So we apply a spray to sanitize the outer skin of the injection or the area of injection, and we get a cotton to dab the area to remove a lot of the amount of the spray we applied, and then we inject the syringe in a 90 degrees into the muscles, and after that we remove it, and quickly after we insert the medication we quickly get a cotton. Okay, now I'll talk about the intravenous injection, which is the fastest way to inject a medication using your syringe into the vein directly. Now, for the sites of injections in adults, the sites would be forearm on the outer surface of the hand, and less commonly the outer surface of the foot, and it's urgent in the cubital fossa, and also external jugular veins. We'll spray the area of injection with a spray to clean it, and then dab it with a cotton to remove the amount of alcohols we've sprayed. And then we get a syringe with the medication or the medicine and insert it into 25 degrees into the veins, and we insert the medicine into it. After removing the syringe, we get a cotton to dab the area quickly. Now we'll start with the third type of injection, which is the intradermal injection, and it's given directly into the middle layer of the skin called the dermis, and this type of injection is absorbed more slowly than the IV, IM, or SC, which is subcutaneous, intramuscular, and intravenous injections. Now, the sites for this type of injection would be the inner surface of the forearm and the upper back below the scapula, and the nurse should select an injection site that's free from lesions, rashes, moles, or scars that may alter the visual's inspection of the test. Now, for injecting intradermal, first of all we spray an alcohol or sanitizer, and we get a cotton to dab the area of the spraying and the injecting. And then we get the syringe with the medicine in to inject it in 10 to 15 degrees into the dermis. and we apply the medicine in it and quickly remove it and get a cotton to dab the area. Now the last type of injection would be the subcutaneous injection, and it's injecting into the innermost layer of the skin called the subcutis or the hypodermis, which is made of a network of fat and collagen cells. Now this injection is also known as subcut or SQ injection, and it works more slowly than an IV, intravenous or intramuscular injection, because it's not rich in blood in this area, so there's not enough blood supply. Now size for injecting a subcutaneous injection would be the upper arm at least 7.5 centimeters below the shoulder and 7.5 centimeters above the elbow on the sides of the back. Outer side of the upper thigh and also the belly area below the ribs above the hip bones, which is about at least 5 centimeters away from the belly button. And the injection site should be healthy, meaning there should be no redness, swelling, scarring, or other damage to the skin or the tissue below the skin. Now again, we spray on the area of injection and we get a cotton to tap the area and remove the spray that we did to remove all the microbes that have been in that area, and then we get a syringe to inject it about to inject it about 45 degrees, and we did that to remove the bubbles and get a cotton to dab it. Thank you all for watching my video, and I hope you learned a lot about the types of injection and you learned about how each one can be made and their techniques and what's the difference between them.